for the new people. But so what I'm going to do is I'm also going to hand a couple copies of the newsletter for you guys to just read while I get too boring. You have some entertainment in your hand also with the pickleball. I'm going to hand these to you. But as I said, the goal of today's workshop is to help you guys have value in understanding how the sport brings what kind of injuries, if it does, and how to prevent it from happening, and what kind of warm-up stretches that you can do ahead of time. So if you, just one copy so I can get a guide. So if everybody can go to the front page, we're going to just go over what I just described with the agenda today. Going to the next page, the history and background, that's more so of the evolution. Over here, how many people have played pickleball before? Okay, so about 80% of the people have played. Okay, 90% of the people have played. And where would you, let's say, give you a rating of novice, amateur, and a pro? So let's start with novice. Okay, amateur. Okay, pro. I'll let you be in the pro category because Bose is somebody who's so he has a background into tennis and then going into pickleball, and he's just done phenomenal. And what I talk to Bose about is like he's been playing pickleball lately, and I envision him, and he's doing that where he's playing pickleball and all of the players around him, his friends, they're just falling off the court and they're on the ground, and he's still like playing pickleball and find himself not having enough partners to play with anymore. But yeah, so before I start, any particular questions that you have, anybody, before I go into the actual specific movements and anatomical area of the pickleball, the game, the history, it was invented in 1965. I want to call it a fusion between tennis and ping pong. The literature says tennis and badminton. I feel there's a lot of hand-eye coordination with this sport. There's a lot of upper body torsional movement with this sport. You're more after the initial first serving move and services and the initial move. It's like the wall setup. You're just in the middle and trying to make sure that there's enough hand-eye coordination going to allow you to keep the ball going. But typically played in doubles on a court smaller than a tennis court, and it's a very fast rising, growing popularity sport. Specific movements and anatomical area that I would like to talk about. Starting with hip, groin, pulls. Anybody who's had any hip discomfort or irritation? And the most common we find is tight hip flexors, and that comes from the position that you have to attain while you're playing pickleball. You're in a say, once you're up front near the kitchen, you're in a very blocked state. You're forward flexed in a squat position. If you didn't have the back flexibility, you're basically bowing in, and then you're trying to do the neck position, so that also can cause neck irritation. And when we go in the later half of our workshop, we'll find what are the good stretches that you can do ahead of time to allow your hips to be loose, allow your back, neck to be loose, and not end up having the tightness at the end. And also, you have to pace yourself at times. You have to realize when you're getting into the sport that you cannot just go in, like, let's say if you have a history of tennis or badminton, let's say, and you've been great at that sport, that you could potentially just do the same time duration or energy going in. Just be respectful to your body and evolve over time with the techniques. But talking about hip and groin pull, what we found more common is the femoroacetabular impingement syndrome. And what that is a tightness in the groin area, and that is pretty common when there's irritation and lack of range of motion of the hip joint. So one of the things I'd like for all of you to try with me in regards to the test of your hip mobility is while you're seated, and that's a very good setup for the test, which is you're basically going to cross your leg. However, you want your ankle midfoot area to land onto the knee of the opposite side, and we just kind of hold there. And the goal is to try to get the knee, which is of the top leg, in line, sort of parallel to the floor. And when you're pressing down on it, if you feel like, is it fairly parallel? Does it hurt when you do try to get it parallel? Is it tight? You feel the stretching? So that's an indication of some hip mobility, tightness, and if it is not parallel is where the goal is, and a room for improvement with getting some mobility going in that direction. One of the good ways to stretch something is do what your test finds. And so like you're sitting and make sure that there's no pain or any sharp sensation, but if it is like just general tightness and no knee discomfort, then you can just gently press on it. You can hold that gentle pressure for about 30 seconds to 45 seconds, and you can do that a couple of times. Okay, and let's switch legs. Let's see how the other leg looks. So one thing to be mindful of, pickleball is more of a unilateral sport than, let's say, a tennis can be similarly unilateral, but then you have a two-handed backhand at times. But that's not the case in pickleball. You just always with single-handed. So it's a single-handed sport, and which means that you are going to be serving with one hand, and you're going to be doing all kinds of movements, and that will mean that you will also require one leg more than the other. Because when you're walking, if you look, you have a nice synchronized tandem walking. I'm getting it all asynchronized now that I'm having to do it consciously how you walk. But yeah, it's the left arm, right leg swing. Think of a throwing motion of a baseball. Is you have to get the right leg out, and then you get the left. I'm lefty, so the left arm forward. A tennis stroke, right foot forward, left arm swing, and similarly pickleball. So you need one side more than the other, is my point. And so you'll find that there may be some tightness more on one side over the other. What that can do is that can predispose you to have the injury, because then you are working with not stable hip at that time, not stable lower back at that time, and similarly not enough a similar ground reaction for just the forces that act to your body when you're running on the ground can create irritation. So homework on that is if you find a discrepancy between left versus right, that you just work a little, one extra repetition on the tighter side when you're going in to the sport. So that's a little brief into hips. What we tested is called external rotation that we need getting in and out of the car, sitting on lower surfaces, floor. But the other rotation is the internal rotation, which is the one that can cause irritation in the hip joint and the groin area. So there are joints to cover, and I'm going to move to the next, but any questions around hip?
Where should you feel that stretch?
Good question. So you can feel it in a couple places. One is back of the hip, the other is front of the hip. So as long as it's within those two sections, and if it is not painful, it's a dull, deep stretch, that's good. Anybody else? Hips? Clear? All right. Moving on to IT band. Now, IT band, the iliotibial band syndrome, is more of a knee, but the cause is the hip strength irritation. And iliotibial band, we have let me see on the picture on page 3 we have. Yeah, we have. So page 3, go to the images and look on the left-hand side where there's the anatomy. And on the anatomy, you see the outside, it says the iliotibial tract. And that's the band that we're talking about. Anybody not able to find? Awesome. And so the goal is to keep that band. You see the color difference, the red versus the white? The red is a perfused muscle tissue, which means that there's great amounts of blood circulation coming into the muscles, and hence the muscles have faster and better recoverability versus a band, a tract, a tendon, a ligament, a fascia, bone. So the whiteness of the iliotibial band indicates that it's a band. It's not contractile. It's more a strap. But however, if you see the top end of the iliotibial band, there is a red tissue, which means that there is 15 to 20% of a contractile tissue, which is named differently, called the TFL, tensor fasciae latae. However, the lower half, this 65 to 70%, or even more, is a strap, which is non-contractile. So the goal here with the iliotibial band is to keep the band loose and keep the muscle, the TFL, strong, and the supporting muscles. So all of the muscles that you see beside it, the iliacus, the psoas major, and the blurry image, we should work on this image, but the blurry image is showing the muscles on the back of the body, and the one that I will point to is the glute musculature, and that's the one that allows your hips to stay stable and strong to not put pressure on the iliotibial band. So if you find yourself having weakness or instability or balance with standing on one leg, or lowering yourself in a chair, or those kinds of irritations, then indicates hip weakness, potentially can irritate tensor fascia, IT band, hence can create pain on the side of the thigh, outside of the knee, and at times the knee joint itself, because it's a two-joint muscle. So it's important to keep the iliotibial band loose if it gets tight or if you have tenderness. A good test to find is called the Noble's compression test. What I'm going to do is, and you guys can be able to do it in sitting, and may not be able to accurately find the test, a positive or negative, but you basically place your hand like maybe a couple to 3 inches up above the knee joint on the side, and then you just give a good pressure on the outside. And does anybody have tenderness when you press on the outside? Okay, and so tenderness indicates some irritation. IT band, as we looked in the picture, it goes from way up down there to all the way up to here. So this is all band. And so you can just kind of work around the length of the IT band and kind of come up. And if you find any tenderness or tightness. And if you had the tenderness, then that's an area of concern. And you just, so the way how you work, let's say if you had the tenderness, which means there are two things. One is that you should work on the hip stretch. And then second is you should work on the mobility of the IT band. Working on mobility, good tools like massage guns, they're pretty famous these days. You can just hold it on the side of the leg, and you can just go up and down. You can do it up to 30 seconds to a minute for individual areas that are tender. Good warm-up, I've got this included into your top 4 warm-up stretches before you play sport, is a good warm-up tool too, because it does increase the blood circulation of the area. It helps you have the warm muscles ready to go, get better contraction, and can be done on both sides. So that's IT band, more of a knee irritation. Didn't talk about the hip strength component, but one way that you guys can actually test functionally is, if you want to join me, you can stand and see standing on single leg and hands on the hips, and then with the dangled leg, I'm struggling a little here, with the dangled leg, if you can hip hike the leg and lower for, let's give a 3 repetitions if you can, while maintaining the balance, and the hip drop and lift. Good. Pretty good. Good job here in the class. Okay, so yeah, let's switch sides and see. Okay. So what we're looking at is the hip strength and the control that you will need. Because think of walking. Walking, in a general term, is like controlled falling from one leg to the other leg. And you do need a single leg stance, support, balance. And then you X that into whatever you're going to do with the running and pickleball and the load that it puts. and it's a good test to measure that way. But yeah, thanks for participating. Any questions with that? Any discomforts? Anything that you have questions around with that for us?
Well, if you can't lift your, means it's not strong enough?
The movement part is more so to challenge dynamically. So not necessarily, as long as you're maintaining a good balance and have some movement going, then it's a good indication that you've got fair to strong hip strength, not poor at least. Yes. Yeah.
I had a gluteus medius tendon repair, and so I can stand on this leg, I can do whatever. This leg I can't do that because the muscle, I guess. you know.
Gluteus medius is a hip strength
Right,
muscle.
right.
Yeah.
And so I think the muscle, even though I have done the exercises with therapy, it just hasn't, the muscle has not come back all the way. So,
Okay.
you know.
Has it gotten better to a certain point, and has it now regressed, or is
No,
it
it's
just?
not regressing, and it's gotten much better since the beginning, but
Okay.
I don't know that it'll ever get to the,
Have you
to where
had
it
a
was.
chat with your surgeon, how good of a repair it was, and has it all fixed? So could you try to get it stronger, or if you did, it was going to damage the repair? That's a good question to ask the surgeon.
I don't know.
Well, how long ago was the surgery?
2 years ago.
Okay. Okay. Yeah, I would ask the surgeon, for safety reasons, if I try to strengthen this hip any further than what I already have currently, they're going to impact the repair. Because again, you don't want to end up to where you need a surgery.
Right, I don't want to do that again.
But muscles do have something called muscle shutdown that happens post-surgically, and that you need to add extra stimulation. It may not be just from the brain, but maybe from an external electrical stimulator device, along with strengthening it, to help stimulate the muscle's contraction and get it over that hump of what you could do by yourself. So when there's a concept called muscle shutdown, it's a physiological response that happens if there is an insult to a muscle in regards to a needle touching it, or a blade touching it, or a knife touching it. And in that case, you need external stimulation, because your brain at that point cannot connect the brain muscle response at that time. So an area to explore, ask surgeon, and then if it's safe, then you can work on some strengthening, which we can help with.
Okay.
All right, so moving on to elbows. Well, obviously elbows have been made famous for three main areas, and there's a fourth one which I'm going to be talking about, but one is a tennis elbow. What are the other two elbows that are pretty famous that you can think of? Okay, golf. It's the third one. Can anybody know the third one? It's a trick question. Well, not really trick, because it's a real thing. It's called student's elbow. Has anybody heard of student's elbow?
No.
All right, so this is what causes student's elbow. So there's anconius and there's a bursa, which is what most of it, the elbow happens, is that causes irritation. The benches, they're hard. The students are having to just concentrate and focus like you guys are having to right now. Glad you guys don't have a desk in front, or else you would end up with student's elbow at a pickleball workshop. And then the fourth elbow is what is now going to be the pickleball elbow, which I have actually seen a case of pickleball elbow. I name it that way, but it's basically a tennis elbow, because there's a lot of lateral muscle, lateral epicondyle of your bone is getting irritated. So I don't think we have a picture for the elbow components, but it's very similar to how a bone, a muscle attaches to a bone, and then if there is constant traction, so muscles obviously need to contract, and when they contract, they put traction forces on the bone, and then there is this connection of the bone-muscle connection that causes micro trauma if it is either too much of strain, repetitive strain, or accidental strain that you didn't anticipate and you ended up doing to yourself. So that can cause irritations. Those irritations can look as simple as just a scar, just a little scrape on the skin, and you need to let it heal and then repair, make sure everything is clean, and then you start to put the lotion and massage and do the friction massage to help clean up the area. Similarly, inside the muscle, you can't see it, but that's what's happening, and there's causing friction, it's causing adhesions, causing pain, can cause swelling, so you have to calm that down by using ice, heat at times for the muscles. You can have muscle knots on the forearms, you work through those, and then building the strength and recovering from any kind of tendinitis happen. Anybody history of any elbow irritations issues?
I had tennis elbow once from painting.
Painting,
Not
yes.
from tennis.
This is a fact. Over 65 to 70% of the cases with tennis elbow doesn't actually happen because of tennis. It happens because of activities not tennis, and hammer use or repetitive wrist and hand use. Even computer users have tennis elbow. Anybody else? Any questions around elbow or elbow irritations?
So how is the tennis elbow different from pickleball?
It's the same thing.
Same thing, different cause.
Yeah, different cause, yeah. That's right, yeah. I think it's what sport you're playing that make it famous, so that's why I said it's the fourth one in the coming, but the fifth one. All right, the knee and ankle, so we talked about a little bit on the knee and ankle sprains. They're more common just because of the nature of the sport. There are experts, pickleball instructors who will guide you and coach you on better shoes for pickleball and what kind of shoes you should have and how you can prevent the rolling. And if you did have to roll, it's easy and not as sudden. So like the shoes that I have right now, it splits it up. It has a very sharp edge on the side and not a very good shoe for, let's say, on the court, hard court running around. But if you have a good cushion, so you have a good support with the roll, or that if you have a rounded edges, that sets you up for decreasing the strains and sprains, because then you're just not like twisting it, going off to the edge, and then just falling off the edge of the shoe. It's more of a roll, and then you can control it better. But again, something that I'm learning there are more and more pickleball instructors around in this area. If you have seen Joni Moser Park, there's a big Joni Moser Park pickleball community that plays pickleball potentially every single day when the sun is out, and Bose can tell you how they do on the winters. They're very passionate about pickleball, and now I think it's a USTA club too. So, anybody plays at the Joni Moser Park? That looks like plenty. But yeah, it's like right across the street. If we are in the back of the building, it should be like right there. You just go out, make a right, Joni Moser, and I think they've recently gotten approved to convert the tennis courts that they had, 2 of them, into flatten everything out. Even the basketball court in the back to convert into 9 pickleball courts. So sad for the tennis community, great for the pickleball community. I know, right? I'm in the middle, but
you can use a pickleball
for tennis. However, not the other way around.
Right.
That's so true. We gotta get more considerate around here, right? All right. So over to the right-hand side of the table. So stick with the second page. On the right-hand side of the table, we'll go from top down. Tight hip flexors, adductors, and internal rotators. So those are just the hip musculature that on the image, the little blurry image you see, and that around the hips are the muscles that we're talking about. And the goal is to try to keep them loose and strong around the hip flexors, adductors, internal rotators. Then second one in the table, page 2 again, imbalance of side leg muscle strength mainly. So that's what we tested with standing on single leg, and if you found any difference, one leg versus another, or even when you check the flexibility, and if we found any difference, mobility one leg versus another. The third is gluteus medius maximus weakness. The medius and maximus, and the third one is the minimus, the glutei, as in together, buttocks, have a very strong, important role in your ability to stand, have stance control, sit to stand, walk, single leg stance, all of that. So very good homework for everybody who found any weakness or have any, to make sure that you have ways to continue to get strong on the glutes. The fourth is the overworked IT bands. So IT bands is the iliotibial band that we talked about, and if you have irritations on the knee joint constantly, then it can create more overwork, and hence the goal is to decrease the work by, let's say, massage gunning it, decreasing it by ice, ice in that area, and then strengthening the hip joint. HQ ratio. HQ ratio is a hamstring to quadriceps ratio, and that is basically how does your thigh perform when you are, let's say, squatting, and I'm going to give you a side view of the squat, where you're squatting, and then how is your knee in relationship to your toes. If you're falling too far forward, then that's like a quad dominant squat. If you're staying too far back and doing more of the hips and not unable to go down from the legs, then it's a lot more a glute dominant. And then what you want is you want the knee and the toes sort of in line, and then you're going gradually straight down and up. And the HQ is the hamstring quadricep ratio, and you want about that 60 to 100 ratio, which is the norm, greater than 60% and up to 100% both strength together. So you don't want the hamstrings to be too weak compared to the quads, and vice versa. You want more of a balance of both sides. And quite commonly with the day-to-day activities that we may be doing, let's say sitting on the chair, driving, computer users, even tennis players, because then pickleball players, in a way that you're using one side of the body, so that's much stronger, and then the other side is weaker or tighter, and then can cause the imbalance with that. And the last is the calf flexibility and strength balance. Calf flexibility and strength, and then the balance. So calf, we want to make sure that you have good mobility. Calf is actually one of my top 4 warm-up stretches, because you're going to be on them throughout the time that you're going to be playing pickleball, the time that you're on your feet, and you want the quickness, readiness for reaching the ball, coming from the back service line to in the front, being able to generate power to push yourself off from one position to the other, and then the balance we talked about in the single leg.
What's the Q angle?
Q is the quadriceps angle. So Q angle is the angle that if I was to stand straight, and in women, anatomically, they have a wider pelvis, and what happens is, so Q means it stands for quadricep. Quadricep is the muscle that goes from top pelvis right here to your patella, and so the measurement is that they measure the angle going straight down and the direction it goes down. And let's say if you had developed some anomalies and your knees are starting to curve in, it increases the Q angle, predisposes you to more injuries. If it's widening out for whatever reason, or you walk with the toes out, it increases the Q angle in another direction, and again puts yourself at a risk or injury. If you have a wider pelvis, you come from a far further angle, changing angle. So there's a norm for males and females, and I think it's about 10 to 12 degrees. 10 to 12 and like 15 to 20 is the cohort, and
10 to 12, this way?
yes, 10 to 12 this way, and that you want to stay within. And if you find yourself having the angles different, then it's just an indicator for maybe potential risk injury. Good question. Anything else before we move on to the treatment nuggets and then the top 4 warm-ups? How are we doing on time? Okay, we got 5 minutes into treatment. So, warming the right muscles and moving all to prevent injuries. Again, a massage gun is a good way to warm up areas that are tight and tender. But overall, the goal is to have maybe 5 to 15 minutes of some quality cardiac activity going. So either you just take a brisk walk on the ground, on the court, you do subtle ankle dribbles, you just get your heart pumping, and the goal, what I'm trying to say is just don't walk into the court and just start playing, because you are going to injure yourself at that point. So have some warm up going, and the right muscles and movements are, as you see, the mobility of your hamstrings. So you want to have hamstring, quads, which is the front. Hamstrings are back here. Front quads, hip flexors are up on top. Calves are down here. And the way you do that is, maybe if you guys want to join me on this, so forward bow. So forward bow is a good way to do the hamstring stretch. So you kind of bring the one foot forward, and then you just forward bow, and you should feel a nice gentle stretch on the hamstrings. You don't want pain, irritation, tightness, nerve symptoms, none of that. And just gentle hamstring. You can actually do it in seated position too. You just stick the leg out and just lean forward. Feel the hamstring stretch. Quads is you can stay standing and grab the foot and then just try to bring the leg back. Goal is to try to touch the heel to the buttock. If it doesn't touch, that's okay. You can always modify.
My problem is the balance. I had a complete quad separation a couple of years ago, and they reattached it. But I don't know how high up I can get it because my balance.
You can use the wall, you can use the back of a chair, and then try it that way, but again, don't hurt yourself.
I had a good 6 months of physical therapy. I couldn't move it at all when it
At one
had
point, yeah, but you're doing good on the mobility of the quads when it has been reattached or even separated, yeah?
But the balance, I couldn't.
So part of what it sounds like happening is when you injure the quads, because when you injure your quads, I'm presuming it was hard for you to stand on the single leg. You needed to use an assistive device for a little while?
Yeah, well, I got out of the walker in 2 weeks.
Okay. What were you using after?
I had crutches for a while, and then I could walk okay.
Okay. So what I'm trying to say is that when you have an injury down the leg, you still need to continue to keep the upper parts of the body strong, which is your hip. And not able to stand on one leg is more of a hip and core strength issue than a knee or a quad issue. Not saying that the quads don't influence the balance, but it is something that you need to work up the chain to the hip more overall. But you have good flexibility on the quads, maybe not quite the strength, so...
They nearly killed me getting flexibility.
Are we to blame? Are we to be blamed? Should I turn? They really killed me, right?
That was how much pain she could give me.
All right, we talked about the mobility of hip rotation each way. Moving on, strength of core stabilizers, strength of quads, strength of calves, glutes. One of the good ways to get them strong is a pain-free banded sidewalk. I'm not sure if I have a band, but you may have seen a resistance band that goes around the knee for exercise purposes. There you go. So a resistance band, and you slide it up the leg, up to the knees, and you can do a banded sidewalk. A great tool to have in your pickleball bag. So on the court, across the fence, they say, hold on, kind of work on getting your glutes warm, hips warm, IT bands, upright posture, core looking from the side, just a little bit of a hip bend, not crossing the knee too far forward, sort of sitting into it, thinking of You have a chair behind, but you're not trying to sit into it. So questions around the banded sidewalk. Squats, again, you can keep the band on and just work on the squats. And then mini planks.
Oh,
Who doesn't know?
sorry.
Who was that? That was Harmony said, planks.
Planks are round.
Does anybody doesn't know about what is a plank?
I don't know what a mini plank is.
Mini plank, good question. Mini plank is you modify it. So if a plank was on the toes, mini plank would be on the knees. So the goal is you're not straining the back at that point because then you are not using as much muscle. But your goal should be from a mini plank to go to a full plank over time. If you're able to do the full plank, you don't need to do the mini plank. All right, good technique in form during play. Use of supports to the joint. So if you have irritation on the knee or ankle or elbow, it is good if you still have the discomfort to use some supports, ankle supports, elbow supports. The goal should be to try to get out of the supports, but not at the cost of just hurting yourself. Incorporating cool down. So importance of warm up and then importance of cool down. So after you've played a sport for let's say 45 minutes to an hour and a half if you are, you're again used one arm and one leg more than the other side. That creates imbalance in your body. If you've been doing that days over days, weeks over weeks, months over months, years over years, can create irritations on the spine, the discs, alignment of your spine, hips, knees in general. So that is something to be mindful of. And so for cool down, you can potentially repeat the same warm-up stretches that we are going to go over, or just try to maybe walk it out to not just, well, the ideal goal would be to have a plan with your body to find out what are the abnormalities that you're ending up having, and then you could define what would be a personalized cool down process for the body when you're trying to get into or not get injured. But a good way to go about it is doing similar warm-up stretches to help with the cool down. And then icing the needed area. So you will probably make one part of the joint a body sore than another. So using the ice is good post game, and a warmth pre-game. Always good. Questions? Any before we move on to our top 4 warm-up tips, stretches before play to prevent issues? All good so far? All right. So the first one is a lunge, step, hip and calf flexor stretching together. I have it two separate techniques. One is a static and dynamic. So a lunge step is you make sure that the toes are pointing forward. You take a mini to a long, so you can do a mini to a long lunge step. You can have the fence right there, and you can just lunge in, try to keep the back knee straight. And the goal here is to get a good hip flexor stretch. It's going to be on the back leg, the front. So this is where you feel it. And then also the back calf on the left. Try to keep the knee as straight as you possibly can. If you need the balance support, you can always hold on to it. So a good stretch. Static is I'm holding it for 30 seconds. I do that twice. And you switch positions. Dynamic is you're just walking nice and slow, the length of, let's say, the court, and you come back. So, questions with the hip flexor dynamic stretches? Next one is sideline thoracic rotation open books. I sometimes hear from the athletes, well, am I going to lay down on the court? Well, yeah, you may want to lay down on the court for this because it is a good thoracic mobility. So you're on your side, arm open, and then you just open the top arm and breathe while you just settle in and enjoy the sky. If it's a beautiful day like today, and breathe. So holding again 30 seconds and closing like so. And you do both sides. Questions with that? It's a good pec and a thoracic spine stretch. The third is a side plank hold. So Side plank is on your side. Forearm, you can, again, mini side plank could be on your knees. And you hold. The goal is to try to activate all of your internal and external oblique core muscles on the sides and help you stay toned on the core to avoid any irritation while you're playing tennis. And then the last one is massage gunning the forearms, elbows, pecs, traps. And again, 5 minutes total. You have that in your kit, and then you just try to make sure everything is staying loose, and you go from there. Questions? All right, well, we have, for anybody who is interested, have an exclusive offer for today for workshop only. And what we can do is a pain and lifestyle audit of just going through history of any irritations, injuries, surgeries that you've had, defining a pain-free future road mapping, going over the report of findings, and also creating a home exercise program personalized to you, plus access. We have an app that has the whole exercise program with videos and gets you access to us. You get feedback on your exercise program, and then adjustments to your routines. So this is an evaluative program to figure out what makes total sense for your current needs and what may you need to help get over irritations if you have. And what we have for today, for attendees only, it's $99 that we're offering. And if you would like to sign up, we can have Maya reach out to you. So, all right, Gubs, we'll get you signed up and we'll get you taken care of.
May I make a couple of comments about?
Certainly.
I accompanied my wife to a no-charge just a basic evaluation a year or two ago. And I checked in, I didn't have any pain and all that. I'm thinking, I don't have any problem. I mean, whatever. And then 30 minutes later, I realized I had all kinds of things. I just didn't know it because I hadn't.
Right.
And then since that time, Sarvar has, on several occasions, detected early signs of tightness and or weakness and balance that would have easily led to problems down the road. Nip them in the bud.
And yeah, and you've done so well. And I give credit to you with your religiousness to how you do things and how you operate it throughout your lifestyle. So kudos to you. But yeah, so that's what we have today. Any questions or concerns, feel free to reach us. If you want to sign up, you can talk to Amaya or just raise your hand and she can just get you on the schedule and call you and get on the books. But you have our number, our website, our email, and we'll keep this offer valid for 7 days if you still are interested and want to talk to us. Awesome. Well, thank you for attending.
Thank you.
And it was great having you guys. Yeah. Thank you.
I've got a question.
Yes.
I saw TJ on my neck, and he did my, and he also said that,
Yeah. Is it? It's like a numbing. Is it sharp? Should be.
Yeah, well, it's not shooting like sciatica or anything,
Okay.
but it will, it's like it buckles from time to time, and I never know exactly what causes it. Now, what was my question?
Where is it?
Something about memory.
Well, memory, maybe that's it.
Right.
I'd love to, what I want to know is I have an X-ray, and I much more with these, and he's an X-ray there, and these are hurting. So is the pain coming from here? That's what you guys are so good at.
We can diagnose. Yeah, this is, that's right. Yeah. So what it sounds to me is that it's the hip that is causing the pain. Doesn't sound like it's the back. Maybe sacroiliac joint, SI joint. Can I pass on a couple areas in the back? Alright, your knees is kind of like tenderness here. There, yeah, that's your SI joint. It sounds like you've got some SI, which is not lower back, but it's also not hip, so it's somewhere in the middle.
I've got, my daughter gave me the net for Christmas, and so we can set that up.
I see. Yeah, so,
Just work,
yeah. Yeah, we could pick up, yeah, and I can get into the real intro of what I'm seeing. You need some more thoracic mobility, you need some more control on your legs, and some strength in your hips, you should be good. And obviously you're in pain, so do some pain relieving maneuvers. Ice, topicals, creams, all those good. Not at the intensity of pain that you have right now. Not dry needle there, but dry needle if IT is tight, dry needle IT, dry needle adductors, dry needle hip flexors, those. And did you know that we now have a dry needling specialist also? Sarah Lester, the girl right in the middle on the flyer, bring it to the card, the flyer card. Yeah.
You want to bring chocolate for our lights?
Oh, okay. I wondered how those, yeah, I knew they were.
She's a dry needling specialist now. She is one of our personalized therapists that kind of thinks the way we do.
Bring a chocolate light, you know.
And yeah, if you want to schedule, start with DJ and then go to Sarah, or
Follow it with
if you want to just reach out to Sarah directly, or Brian, and we can appreciate the offer too. If you want to take advantage of it in 7
It's
days.
on our mind.
All right, pleasure seeing you. Does anybody else have a question?
I just wanted to say, my name is Pete Horace,